Good morning, good afternoon. Welcome to the COVID Town Hall. And we've got a nice group of people who've joined us already. So we're going to get started at 12:32. That might be one of our earlier ones. So thank you all for being here. And Marco, I think you are on. So I'm going to turn it over to you for some opening remarks.
All right, Sherry, can everyone hear me all right? Yeah? All right, good. So good afternoon and almost noon, everyone. I'm Marco Giordano, your CEO, and I do appreciate again everyone taking the time to join us this afternoon or this morning if you're out in the Midwest. Before we get started today, and as we gather today, I do want to just take a moment to acknowledge the conflict that's occurring in Ukraine. As I'm sure many of you, if not all of you, will join me in sending positive energy, your thoughts, your prayers out to the citizens of Ukraine, and as well as to any friends and family within our community here at RHD. So we have been coming together here for the past 2 years. Our first COVID town hall was almost 2 years ago, believe it or not. And you know, that is a lot of good afternoons and almost noons along the way. For the past 2 years, we worked together to respond to a pandemic, something we never did before, something most people never did before. We responded to an unprecedented event with the rest of the country and the world. And together we embraced what was necessary to keep each other, the people we serve, and our families healthy and safe. While not without its challenges, we did it and we did it well. So kudos to all of you. I could begin to share all of our successes and all of the opportunities that we have as we move forward that surfaced during the past 2 years. However, I'm not going to do that today. In reflection of the past 2 years, today, I'm simply going to say thank you. Thank you for your stick-to-itiveness and your commitment to the people we serve and to each other. Thank you for being there when it was hard to do so. And thank you for your patience, your time, and your understanding. For the past 730 days, that's a wild number, 730 days, many of our staff, each and every day, were on the ground fighting the fight, literally risking their lives every day for the people we support. And many staff were providing support, direction, guidance, and leadership along the way. And as we know, much of this continues today as we gather. Together, we continue to sing, sometimes way out of tune, persevering and supporting each other in that proverbial mud. Those that have been with us for a while hopefully remember some of my thoughts I've shared in earlier meetings. However, while uncertainty still remains, it is time we begin to step out of that mud with caution. We have learned a lot along the way, and this experience, the experience of the past couple of years, has changed us individually and has changed us as an organization. The virus remains unpredictable, so we will continue to practice protocols grounded by the CDC as well as by RHD values. However, there's also opportunity to begin to thread COVID-19 into our everyday life and to remove it from the pedestal it has been placed upon over the past couple of years. As an organization, we will begin this journey and take steps towards threading COVID into our everyday lives and shine the spotlight back into or onto the great work we do and have done continuously throughout the pandemic. As part of this journey, there's also time needed to heal and recover. The past 2 years have been traumatic for all of us. And the trauma we experience might not always be apparent. So as you know the saying, each of us were in the same storm, but in different boats. So it will be important to determine what you need and seek out the support you need and take care of yourself. Because focusing on your well-being today will allow you to continue to navigate your boat through the shifting winds. So today, you will learn about some initial steps that we are taking on this journey. I encourage you all to continue to share your voice, your thoughts, expressing your needs and curiosity through question, so we can continue to work through this next phase of the pandemic and, fingers crossed, soon to be endemic together. Because truly, we are better together. So thank you all for joining us today. Thank you for all that you've done during the past 2 years. Thank you for what you continue to do to respond to the needs of each other and the people we serve. And I appreciate you all joining us this afternoon. Sherry, I'll turn the mic back over to you.
Great, thank you, Marco. And Mary, if you can pull up the agenda. And lots more people joining us, so thanks for joining, everyone. We're going to take you through the housekeeping now, but we're going to hear from a couple folks around some changes to the town hall. First, we'll hear from Baroness and then from Linda. Bernie will speak to the mask mandates. Christy's going to share a bit about Helping Hands and some other resources that we can continue to use. And then, as usual, we'll open it up for the Q&A and then some closing remarks. As always, we want you to submit your questions, as early as possible. We're learning that when you submit them early, we can put them in groups. So use the chat, submit them through your voice or the COVID-19 inbox. We have people looking at all of those different vehicles so that when we get to the Q&A, we will do our best to answer all of your questions. And with that, I am going to pass it over to Baroness, and I'm going to ask Mary to pull up the slide in relation to that. Give us a moment to get that up. There we go. Thank you, Mary.
Good afternoon, everyone. Can you hear me? Great. I just want to start off by saying a little bit of matter of fact, a lot of thank yous, but thanking everybody for your commitment, your support, perseverance over the last 2 years. It's been pretty crazy and very uncertain, full of a lot of angst and a lot of emotion for a lot of people. But for our staff, I just want to say thank you for how you've just continued to press through it and really show up like RHD shows up. So I want to say thank you to everyone. Just want to give you a quick update. We have the leadership in the COVID committee has been meeting to talk about basically how do we continue the COVID town hall format and what's the best way to do it. And so the leadership has, along with feedback from your voice and emails that have come in after the town halls, we evaluated the best ways to meet the needs of the RHD community and to communicate the information that we share throughout the pandemic. We got, like I said, a lot of feedback. And so what we are doing is we're changing the town hall format. We decided that the best way to support our staff is to provide information more local and closer to the programs. So the COVID town halls will be replaced with IDD, BHH, and shared services COVID question and answer meetings. So to that, I'm basically just saying that we will not be having the COVID town halls as we've been having them in the past. They'll be more localized. And hopefully, this way will provide a better way for your questions to be answered. We will assign subject matter experts, I was going to say SMEs, but subject matter experts to attend the meeting so that they can help provide more consistent information and answer the questions more consistently across the organization. I think that we will continue, I know that we will continue to have the COVID town hall or COVID-19 as a staying agenda item or topic on a quarterly RHD, state of RHD meetings. I'm sorry, I'm like trying to do two things at one time. I really need to focus on you. But we will go back to quarterly state of RHD meetings, and COVID-19 will remain an agenda topic for as long as we need it to be. So again, we're changing the format. We will no longer have the COVID town halls. We'll have divisional meetings and shared services meetings where we'll discuss the topics and keep you updated on all COVID-19 matters. Thank you. If you have any questions, please let us know during the Q&A part of this particular meeting. Thanks.
Thanks, Baroness. And then Linda, if you could pop on to talk a bit more about that meeting. Great, thank you.
Absolutely. And thanks, Baroness, for kind of laying the groundwork there for what is next to come. Before I go into the details, I do want to just say, when I look at everybody that's on these calls, I know we always are, we work very hard. We're so busy in our department or our team or our program. And when we get together like this, it really shows like who is our community. It is everybody here and so many people that are not here. But it is comforting to just realize we are the one community really trying to work toward getting through this difficult time. And we're ready to take the next step. So as Baroness said, we're moving more. We really want to make sure that we've always been assessing what is needed, what information is needed, what practices are needed, who needs to come together to try and work through some of these really complicated things that have come up for us during COVID in the last couple of years. So we're shifting to a format that's at least monthly, and we're going to have a shared IDD BHH meeting because we do find a lot of the issues are consistent between the programming. So it's not so much about what type of program you're operating, but maybe where it is and staffing issues that are really consistent throughout. And then also a separate shared services meeting, which the date will be should be being able to be shared soon for that. So we will meet at least monthly, and we're going to have, we got some feedback that the time of day that we've been running town halls, and there's no perfect time, but that lunchtime, a lot of our programs are really working on lunchtime and feeding our participants during that time and couldn't attend. So we're going to run the same meeting, but once in the morning and once in the afternoon. So it's the same format, any questions that come up would be shared across, but we're going to just try that and see how that works. You don't have to come to two, it's the same one, but just offered for to kind of help with the type of program that you're running for that. We have the first one scheduled for behavioral health and IDD. It's going to be March 21st at 10:30 in the morning Eastern Standard Time, and then at 3 o'clock. Again, same meeting, you can just need to come to one. However, don't hold your questions. That's one thing that we want to make sure probably everybody that you hear from today will say, do not hold your questions. Reach out immediately to your regional director, your service line director, your subject matter expert, myself, just don't try and sit alone with a question. If you have one, really reach out for that. And then as Baroness also shared, as needed, the subject matter experts will join those meetings. If people have questions ahead of time, you can send them to me, to Sandy, to Bernie, to Brandon, so that we could be prepared. If there's a particular topic that, several programs are just really wanting to talk through, we can do that as well. We did have our first one last week, and still are searching for feedback on that format, what worked, what didn't, and we'll continually do that. As we have these meetings, we want to hear what's been effective and what's not, so that we can make sure we're getting everybody the best information possible and the best support as possible from your leadership. So that's it for me right now, Sherry. Again, we can take questions during the Q&A period of anything that may come up for people. So back to you.
Great. Excuse me. Thank you, Linda. And then I believe we have Bernie on to talk about the mask mandates.
Thank you, Sherry. Good morning and afternoon, everybody. I appreciate everybody attending. I wanted to talk real briefly about the mask mandates. One of the constants over the last 2 years with COVID seems to be that there's always information coming from multiple sources, and we never seem to get the same information from all the same sources at the same time. So we really think that in some of the feedback that we've been getting, that we think there's some confusion. So we wanted to take the opportunity today to give everybody basically just a gentle reminder that the RHD protocols have not changed in terms of testing and in terms of mask wearing. You know, we are still requiring folks to wear an N95 mask when you're working with a consumer who's COVID positive or suspected to be COVID positive, a KN95 mask when you're working in any of our programs, dealing with a consumer and working actively with our participants, and a surgical mask if you're working in any of our administrative spaces where you're going to have no contact with any of our participants. That hasn't changed. We know that over the last couple of days, there's been a lot of changes from the CDC. There's been changes from cities, from states. The state of Connecticut has made some tweaks that we're still vetting. Montgomery County put something out the other day that we're still vetting. So as changes come up, know that if you see them, send them to us. Usually we have them, but maybe we don't, that we will vet them, that we take it all into consideration. But the point being that many of the changes that the CDC and the local governments are talking about are for public spaces. We don't work in public spaces, and we work with folks that have particularly compromised immune and medical challenges in their life. So we are being a little more cautious than others. So the masking protocols, they have stayed in place. As an example, I live in the state of Delaware. Governor Carney announced the expiration of the universal indoor mask mandate in Delaware, effective February 11th. However, if I go to one of the programs in Delaware, if I'm working in one of the programs in Delaware, I still need to follow the established protocol that we set up at RHD. And again, we need to make sure everyone understands we're not working in a public space, and we're working with folks that are very compromised. And I know we all know that, but we're all seem to be getting barraged with different information. We just wanted to take a couple minutes and give folks a gentle reminder for that. I recommend that if you have any questions, like Linda said, send them to us and we can address them either right away or at the next divisional town hall or shared services town hall meeting. Also address your questions to your immediate supervisor, your regional or department leaders, or your service line directors. Thank you. And Sherry, I think I'm throwing it to Christy, right?
You are. Thank you.
Yep.
Hi, everyone. How are you today? I'm glad to be here today. I'm having a good day, and it's because I decided I deserve a good day. It's the second day in a row I've decided consciously I need to have a good day. It's sunny in Philadelphia and it is cold, and that's okay because I have been thinking about spring. I've already been planning my garden ideas, what to buy and how to do it, because I needed it. After the past few weeks, I just needed to say to myself, I need a good day. And the only way that works for me is if I wake up and I make that conscious commitment to myself. I have to do this because otherwise I can snuggle in bed all day if nobody's looking. You know, I can blur my background sometimes and I can just snuggle. So I'm just here to say, if you haven't started your day or it hasn't been great yet, start right now. Let's start over. Everybody, if you have a window or a skylight or something, look outside today because spring is coming and I'm so happy. I also want to talk a little bit about helping hands. Please reach out. I put my phone number, my real cell phone number in the chat. And that means I just shared my phone number with 178 of you. Call if you need to. I can refer you to someone. I'm here to chat. That's why we have Helping Hands, and it's internal because the people we have vetted for Helping Hands, they understand our values and they know who we are. I also wanted to say SIG Ferguson, you're everything. Has anybody noticed my flyer this morning about all the activities going on this week? I can't take a single bit of that credit. SIG searches the internet for pictures of people who look like us, and they're so good. And you all respond, and people say to me all the time, like, I love the picture, I'm gonna join, but SIG is the one who finds the pictures. And if you haven't tried any of the activities, just try one. I don't know if anyone noticed, but Emily Wiggins is back and she's doing Zumba, and she's one of us. She gets it. She's gonna sweat and dance and smile with her dimples, and like, it just feels good. So if you've never tried it, give it a shot. And the other thing I want to say is that yoga, we're about to change the time. It's 5 Eastern Standard Time, but we're going to switch it, I believe, to 7 or even 7:15 so more people can join. Camera on, camera off, it's totally up to you. I do it. Sometimes I just lay on my mat and I breathe, and sometimes I let my dog sit on my mat or whatever. And lastly, if you're looking for any like short e-learnings, look at Cornerstone. There's some great things. Even if you've done it, go back and do them again. They're all under 20 minutes and they're really good. It's alphabetical under W for well-being. Let me think. I know I'm proud of it. Let me think. That might be it. So my phone number, I'll drop it in there again. Happy spring. I hope I see you all at Fit Camp, yoga, Zumba. Reach out if you want me to come up with some cuckoo ideas for you and your team to get together and do some fun stuff. I always have prizes. Take me up on it. Have a great day. Call me. That's it, Sherry.
Yep. Thank you, Christy. I really appreciate the reminder to, it's a choice sometimes to make it a good day. Sometimes it doesn't feel that way. So thank you. So we are going to open it up for Q&A. I'm going to just ask a pause here so that Sarah and Mary get a chance. And I'm going to give Sarah the heads up that I'm going to start with you. And I'm going to ask if we got any emails on the other vehicles, not the chat.
I do not have anything right now, Sherry. So we can go to Mary and I'll keep an eye out.
And Mary, have you had enough time to look at that? Yep.
All right. Hey, everyone. So the first question here is about testing. What is being done about the COVID testing widget? There seems to be an issue with uploading test results. So even if you upload your test twice weekly, your name may end up on the ineligible work list for only uploading one test.
I can take that question. So for the reporting, it could be about timing. The reports are generated as of midnight the night before. So if you are uploading your test results in the morning, that will not appear on the report, and you should have a conversation with your supervisor, your program director, letting them know your situation and providing them some information on the paperwork. If that's not the case, then I'm going to encourage you to email, I think it's vaccinemanagement@rhd.org. I'm going to put it in the chat for you to see it. If you have questions for test results that you've uploaded not the same day of and you're still on the report, or if you have issues with vaccine information not being processed through, you can ask those questions to that email address, and the people who are responsible for maintaining that data will get back to you. It's generally a day or two that they take to do the research and get back to you, but no, there's a team looking at it. So I'm going to go ahead and put that email address in the chat for those specific questions.
Great, thank you. The second one is about vaccines. Are there talks in place about the vaccine mandate being discontinued, especially with the mandate not being in effect yet because the firefighter union is suing the city of Philadelphia over the mandate? So Brian Joel answered this in the chat, so I'm just going to read his answer so that those of us who may be on the phone can hear it as well. So he says, the Philadelphia healthcare worker healthcare institution mandate remains in effect, and RHD must comply or continue to comply. The firefighter union has challenged the Philadelphia city worker mandate and is currently on hold pending court litigation. This challenge has no impact on the mandate that RHD is required to continue to comply with. Sherry, for now, those are all the questions for the chat, but we can check back with Sarah and I'll keep an eye out.
And I'm just going to check with Brian. Is there anything else you wanted to add to that, or did that capture everything?
No, I don't think so, Sherry, unless I somehow misunderstood. If I'm hoping I'm answering the question, but if there's follow-up, I'm happy to answer.
Great, thank you.
I don't have anything, Sherry.
Great, thank you. So I think we got a couple.
Yep. There's someone who's asking, maybe Christy or someone who may know more about it, about the Balance app free 1-year access that we've been getting emails about.
I believe Nafisa shared that information. It didn't come from me. I wish it did, but I think that that's her.
I could actually speak to that. It's from the Employee Resource Network. So that's like it's a meditation app, and it's not an offer through RHD. It's actually just an offer that some of our employees were using already, and they wanted us to promote it. So when you sign up, you get your first year free. It's a meditation app. So it's really awesome for helping you kind of figure out what meditation can do for you. You can kind of figure out what you want to help your sleep schedule, your focus, your energy. And yeah, it was just brought to our attention. So we wanted to share it out with everyone. You don't need a code. You just sign up for it on like the app.
Thank you. And Mary, I think they're starting to come in again. Do you want me to take the next one?
Yeah, well, I'm all right. I can.
You got it?
Yep. Will the specific BHH and IDD COVID meetings be open to all employees? Shared service specific needs also overlap with the division particulars in terms of policy follow through.
So I can take that. Yes, it would be open, and that's why we really made it 2 different times to just have it as accessible to people as possible. There is some overlap for shared service department, but we also felt that at one moment in time that there was enough differences to hold that separate. So the other thing that gives me a chance to just say, this is our plan. If there is anything that arises that we feel like we need to pull together, we will do that. You know, we're not going to wait for the next month if there is some sort of crisis or anything urgent that we need to come together.
Awesome. Thanks, Linda. I saw that Alicia also mentioned something in the chat. I'm not sure if Alicia wants to speak more on it or not.
Nope, just that, as Linda mentioned, that there will be subject matter experts in the service line meetings, and so there'll also be a conduit, and the leaders from each area will determine how that gets managed, and that there will also be a shared services meeting as well to make sure that shared services is not overlooked in terms of when those meetings will be. And I think that the shared service executives need to all work together to figure that out. I think we just talked about that last week. So I don't have a date. For that one, Marco, but I think that is something that I know we discussed as a executive team.
Hey, Linda, I'm going to ask a question, Sherry. If I wanted to attend one of your meetings, could I?
Oh, sure.
Okay.
Absolutely. Yeah.
Sometimes it helps me understand the landscape. So great. Thank you.
Yeah, absolutely.
Be true to others as well.
Mm-hmm.
Yeah, great. All right, Mary, back to
I'm good on questions for now, I think, unless I missed. Oh, great. Can someone re-explain the 403B for those that do not actively contribute but are eligible for RHD one-time contribution?
Explain, is there any more, explain what, Mary, is there any more in terms of explaining it? And then I'm asking Denise Williams is on here. She's the benefits director. I'm sorry, go ahead, Mary.
No, that's all I have. So I don't know if Sheena wants to explain a little bit more. What
explain 403B contribution? Is that the question?
Yeah, I guess yeah.
maybe how it works. I don't know.
Sheena asked, do you have to keep it in the account?
If Tanika Williams is not on, then I will answer.
I'm here, Alicia. Thank you. Hi, everybody. Tanika Williams here, Director of Benefits. In situations where you want to possibly withdraw monies, according to 450 regulations, you can only withdraw up to 50% of what's available in your account unless you become terminated with the organization. You can only pull out up to 50% of whatever's in your account. No, you do not have to contribute. If you're not contributing on your own, it is perfectly okay. The requirements that were set forth for the one-time allocation were that you were employed for at least 1 year as of June 30th, 2021. So not 2022, but 2021. And in addition, for other situations, there were people that were excluded. Does that answer your question?
We can see if Sheena has a follow. Oh, yes. Great. Thank you.
Tanika, I would just add a caution for those. When you leave RHD, Tanika referenced that you could do something different at that point in time. At that point in time, if you chose to, Tanika is the right word, cash out the 403B?
Yes, you can cash it out. You can roll it over to another 401k or other retirement plan, or you can roll it into a personal IRA or something of that nature. But that is only at the time of termination.
But there are penalties. Please caution.
Mm-mm. Not if you roll it over.
No, but to cashing it out.
So it's a taxation of 10%, correct, Alicia? Yes.
I just wanted to make sure everybody understood that, because otherwise it sounds like, oh, I could just cash it out when I leave. I could just take it all. There's, yeah.
There is a penalty. It's called the IRS. So you would have to ask your accountant because it is dependent upon your income situation. That's not a question I can answer as a whole.
So Tanika, I have a question that was posed to me and I didn't know the answer. I asked people to reach out to you. I don't know if they did, so let me pose it, please. If I'm an RHD employee and I'm eligible for the one-time 403B contribution, but I have not up to this point been contributing, are there any actions I need to do to get that money into my account, that one-time money?
So the money, as long as you become an employee with RHD, we automatically set up an account for each employee, regardless if they're contributing or not. In order for you to do anything with the monies, yes, you have to log into Empower and set up your account. But you do not have to essentially set up an account or be contributing in order to be eligible for the contribution that we made.
Thank you.
You're welcome, Bernie. Just checking the chat. All right, guys. So as always, please reach out to the benefits department if you have any questions relating to your 403B contribution. And we're definitely here from 9 to 5. Thanks, guys.
Tanika, it's Sherry. Is there anything for folks to read or reference? Because obviously it's retirement accounts. There's a whole body of knowledge. So is there a place where people could reference this information maybe before they reach out to you?
Absolutely. We've sent out a couple of publications to all of RHD staff. You also have the option of logging onto the website where there is a plethora of information in which you can decide on which types of funds you want to allocate and access for your 403B contributions. Also, it goes into not just retirement planning, but financial planning as well. So I would encourage everyone to go to the website because they have more specific information that you can be provided with.
Benefits is here, but we generally only answer general questions. We are not the subject matter experts, so it would be advised that you contact Empower directly.
Tanika, could you put that website in the chat by any chance?
Sure.
Thank you. And I'm gonna go back to Mary and Sarah. Any other questions?
Yeah, I think on this, sort of related on this subject, someone is asking if we can talk about access to our W-2 as this person's having trouble printing theirs.
Mary, I'm gonna pivot that over to Byrne. If she can come off mute.
Hi, everyone.
There we go.
If you previously have registered to receive your W-2 electronically, I'll share the path and I'll also add it in the chat. I also send it in an email, but I can also send that again. When you would log into Lawson, you would go into employee self-service, which is the same place you go to print your pay stubs, and you would follow the path that says tax and docs, DOCS, and then you would go over to tax forms. And now when you go in at the top, you'll see a green check mark if you've already authorized to receive it electronically. If you haven't authorized, you still can, and the form will automatically pop up. So you would just, there's a set of directions in there, instructions that will tell you how to register to receive it electronically. And then down the bottom, you want to always make sure you're at the view my documents section, not the delivery settings, which is at the top. You can email me directly if you have individual questions, but if you're getting calls from former employees, this year we did something different and we mailed all the former employees W-2s because we had a lot of trouble with the website last year, people accessing the website. But they're also able to receive it electronically, and we have a separate set of directions that we can email out. Let me know if you have any additional questions, but I'll resend the email today with the directions.
Good, thank you. Someone's wondering, is there any place I can get information about the amount of taxes taken out for those with benefits?
Do you mean from your W-2 form or?
Oh, with dependents, sorry.
Oh, dependents, okay. So in 2020, the IRS changed the requirement on, sorry, my video's off. In 2020, the IRS changed the requirement on the W-4 form that you no longer provide dependents on there anymore. Everything's entered as a flat dollar amount. Previously, prior to 2020, it would send tables that had income brackets and different taxes that would come out depending on how many dependents you have. That no longer applies. There's no tables like that anymore that are delivered. My suggestion, if you need help with completing the form, is there's on the irs.gov website. If you type in W-4 assistance, there's a section on there called the W-4 calculator that you can enter your personal information all the way through this system, and it'll help you determine to put on the W-4. In payroll, none of us are certified tax preparers, so we can't listen to your personal situation and try to advise you what to put on the form. We can only really answer general questions, but I have forms available, and if you read me, I can send you that direct link to the IRS website that'll help you enter your personal information.
And remember that that form on the IRS website calculates your amount by the amount of time left in the year. So if you filled out that form at let's say in November, it's going to show a different amount than if you filled out that form in January, because of just how the IRS set it up, just to follow up on Vern.
Thank you. And I believe Alicia is saying if you have individual questions related to taxes, you should email payroll department at rhd.org, and the email's in the chat there. Another one on Empower Retirement. Is there a fee to begin contributing to Empower Retirement?
There is no fee. As you may not know, a 403 contribution is tax exempt. So you do not have to pay any taxes on that information. It's only when you withdraw. There are administrative fees if you withdraw a portion of your 403B contribution, and then you're also subject to taxation.
Okay, thank you for the clarity. Sherry, that's it for the chat right now.
All right, so we'll do a quick pause. We'll do a little wellness break, 3 big deep breaths in and out. And then if there are no more questions, we'll turn it over to Marco. So big breath in and out. 2 more. That's enough. I don't see any more questions. So Marco, let's turn it over to you for closing remarks.
Yeah, I appreciate that well-being minute or two there, Sherry. I think we all need it. Appreciate all the questions being asked today. And if there's one takeaway from today's call is to continue to have those questions presented to us. As Linda shared, let's not wait for formal meetings to get the information that is needed, particularly as our meeting schedule goes to a different frequency. Want to thank Tanika, Betsy, Bernice for sharing your thoughts today on our 403B and our W-2s and taxes. I learned something today that the W-4 process changed back in 2020. So hey, it's a great learning opportunity for all of us. So as everybody knows, if anybody's paying attention, I know over the past couple of years, maybe we've lost focus, but today is the end of the month, end of February. The last day of February, which also means it's the last day of Black History Month. And I want to just take this opportunity to thank Baroness and thank the Black History Month Committee for providing us with a month filled of reflection, learning, and fun. It was so much appreciated during the month and very much a nice way to break ourselves from the work that we do every day, the hard work that we do every day. My understanding, although I could not be there on Friday, my understanding is Baroness and the committee dropped the mic or several mics on Friday. I was not there. I'm looking forward to watching it on playback once the video is released. So kudos to the committee and kudos again, Baroness, for your leadership. I'm going to leave you today with a quote from President Zelensky, his plea to the people of the Russian Federation that I truly believe reflects also the opportunity we have in our work each and every day. So here's the quote. Neighbors are always enriching each other culturally, yet that does not make them one entity and does not separate people into us and them. We are different, but that is not a reason to be enemies. So I leave you with the thought of being curious, question, and be kind to each other as you move through today and the next the days ahead of you. Have a great day, everyone.